My name is Diana Venegas. I am a public health nurse and I tested positive for COVID December 2020. I developed the symptoms before I got the results, but I had already gotten tested. It was like a slight cough, which progressively got worse. I started having fatigue and headaches. It wasn't until the 7th day of me testing positive that it took a turn to getting worse. The coughing and the chest pain, discomfort was pretty bad. I had trouble taking deep breaths. I realized that it's not just like a common cold. I was trying to work remotely the first week, and when my symptoms got worse, I just had to make a decision to take some time off. In my personal case, being a fairly healthy individual, I found that 10 days is not enough for recovering from COVID. I think 20 days is what it took, a little over. I think it's important to share our stories. I don't know where I've got it, but I think at the end, many of us in the community are exposed to it, and whether we get it or not, I think it's very important to remove that stigma as to whether we were the ones that exposed someone else or someone exposed you. I think it's really important to just take care of each other, take the proper precautions, and if you do become positive, not be afraid to talk about it. You can protect your community and your family and your colleagues by being able to talk about the exposures and the possibility of exposures without making anybody feel uncomfortable. For anyone that's planning to gather with family members, I'd just advise to think about your loved ones, especially your elderly family members. I think there's going to be plenty of time for gatherings in the future. Try to show love to one another in different ways, and definitely wear your mask and keep social distancing at all times, and get your immunization when it becomes available to you.